is a two-way thing.
Hello, good evening, ma'am.
Good evening. Welcome to class.
Thank you very much, ma'am.
Yeah. All right. Good evening, everyone. You are welcome to today's online facilitation class of NSC 303. Today, we'll be discussing the title, Healthcare Resources, Monitoring and Evaluation of Health Services. Unit 5 is quite broad, so we'll only be covering healthcare resources and monitoring. Next week, we'll cover evaluation of health services. And I also want to let you know that before the end of today's class, we'll be having quiz. So be prepared for today's quiz. I informed you last week that we will have quiz today, so I expect you to have prepared. So we are going to have quiz before the end of today's class. So earlier on, I posted yesterday, I posted the instructional video of which I expected learners everyone to have accessed it and go through it for us to have an interactive class session today. So for those of us that have been able to download the instructional video of what I'm to facilitate you on now, is there any question that you would like to ask and that is not clear that you want me to throw light before I ask my own question? I always like to give students opportunity to ask and clarify areas that is not clear while they are going through the video before I ask question. So you're welcome to ask question and area that is not clear to you. This is a perfect time and opportunity for us to reason together. Like I always say every week to you, that both assessing and listening to the instructional video, attending online facilitation class, attending to your assignments and participating in the quizzes all forms your assessments at the end of the semester. So it is very important that you take part in all of these activities. And the essence is to ensure that students pass at the end of the semester. There is no way you participate in all these activities and you will fail in the exam. So I'm encouraging learners, and please do encourage your colleagues as well to attend classes and to attend to their assignments and to listen to the instructional video that has been provided. For this 1 hour facilitation is not enough to cover the whole unit, and that is why the instructional video has been provided earlier. That is more elaborate. And here, we are here for this 1 hour to now reason together and interact and see areas that you need more explanation, then I can provide it. So I think that's very important for me to let learners know. So I'm going to post the quiz kindly. Quiz. So I'm typing in the quiz. Prepare to have a quiz now. Question 1 is question. Your quiz is actually coming from what we've covered so far. Remember, we've covered the definition of primary health care, and we've also looked at the components of primary health care. So I'm bringing your quiz from that unit. Question 1, list the components of PHC, primary health care. Okay, so that's the quiz. You post your answer on this chart and it should be marked and graded. So I also want to let you know that part of the plans that I have for this course is for students to do what we call presentation. But because most of you have been skipping class, that is why we've not been able to allocate your presentations to you. But from next week, I would want students to start to present. Take for instance, we are doing the evaluation of healthcare services next week. I want like 2 or 3 or even 5 students to come up together and have a presentation. Maybe one students during the presentation will actually discuss or give the definition. Another person will give the types of evaluation and so on and so forth. So remember that this is student-centered learning. And in student-centered learning method of teaching, the students are the focus. So the students do more of the talking than the facilitator. And so next week, I'm looking at those of you that are online who would like to do a presentation among you. It's not really a big deal. You don't have to present a slide, but if you can, that would be well appreciated. You can just, from your course materials and other resources that have been provided, let us have a draft of what you understand by evaluation of healthcare service. Then another week, another set of students will present on Unit 6. So that's how we're going to have it until the end of our 8 weeks. I hope it's well understood. Fine. So while you are posting your quiz, allow me to quickly share the screen that what I prepared today. Okay, I've introduced the topic is Unit 5, Healthcare Resources, Monitoring and Evaluation of Health Services. And we also have learning goals for this unit. That at the end of today's facilitation, and I haven't listened to the instructional video, learners should be able to describe the measures to develop human resources for health, explain ensuring community involvement to be adopted by the Ministry of Health, as well as the scope of health manpower. Also explain the actions required to develop monitoring and evaluation process. So from what you have learned so far, what is resources and how many types of resources do we need in primary health care management? I'm expecting feedback. How many resources do we need? Of course, you do know that human resources is non-negotiable in health system. The doctors, the nurses, the community health workers, the pharmacists, the lab technicians, these are our human resources. And of course, we also need finance, money, and materials. These are the primary resources that is needed in healthcare system, primary healthcare system, for effective and smooth running of primary healthcare system. So we need the human resources, we need the human resources, as well as we need finance, as well as materials. Okay, I see your answers coming in. Keep sending them. And I also crave for your interaction in this unit. So feel free to contribute and ask questions. For those of us that we do not know, quizzes carry marks, assignments carry marks. Even your contribution in the class session like this also attracts marks. So it's up to you to choose to participate and earn your marks, or not participate and lose your mark. So as I was saying, that we have human resources, financial resources, as well as material resources. So all these resources are essential to have a smooth running of a primary healthcare system. And so we also have strategies. We have strategies and definitions. Under strategies and definition, and definitions, we have what we know. I've mentioned to you the types of human resources that is required in a primary healthcare system. We also do know that health needs and demands of population is something that you cannot, how do I put it now? Neglected. You cannot neglect it. It's essential that health manpower requirement for a country is very essential. It's very, very essential. And the health needs in turn are based on the health situation and the health problems and aspiration of the people. So the health needs and demands of the population is based on the situation and the health problems of the community. Also the desired outputs. You also need that the desired outputs for these resources to be put in place is that you want to prevent diseases, you want to promote wellness. At the same time, you want to cure the occurring or the existing health problem that is already on ground. I also want to rehabilitate and also eradicate, We do have sector-wise distribution. What do we mean by distribution of wise sector? We have the public sector, we have the private sector, we have indigenous system of medicine, we also have the voluntary health agency and non-governmental agency. And so all of these have their role, they have their functions or the roles they play in the nation. For the private sectors, we know that they have their own important roles that they play in providing resources, at the same time monitoring of health care. So we also have the NGOs. So with someone the question is posed on the youth. Okay, thank you, Seta, for responding. Yes, list the components of primary health care. That is the question. All right, yeah, we continue. The question is there on the chat, respond to it. And also, I will also post a discussion on the forum. Please also contribute, read the discussion on the forum and provide your opinion, your ideas or your thoughts on the discussion that will be posted on your page. And so, as I was saying that the NGOs, the non-governmental organizations, also have their role that they play in the healthcare resources as well as monitoring. And so the private sector, the public sector, when we say public sector, what do we mean by public sector? Can someone share with us what he or she understood by public sector? Please kindly share with us what you understand with public sector, private sector. Then let me assume that everyone understood what private sector, public sector, NGO. Is there anyone in class? Okay, I can see your electronic hand. Please. Inyoma. Yeah, you can speak.
Yes,
Yes,
good afternoon, ma'am.
Good afternoon.
Good afternoon, ma'am.
Good afternoon.
Okay, my name is Inyoma. What I understood, what I understood by good afternoon, ma'am.
Good afternoon.
It's like network is bad.
I can hear you. Just speak on.
What I understood by public sector is the okay. I said what I understood by public sector is the government established institutions.
Correct.
Like government hospitals, government established institutions. That's what I understood by public sectors. Because yes, there are private sectors owned by individuals. Then there are non-governmental organizations owned by charity, groups of people that came together to run charity organization, to alleviate suffering from people, to give hands to people. That is a non-governmental organization. That's what I understood by that. Okay. The public sector is the government established sector, hospitals, schools, and all the rest.
Okay. You are right. Thank you so much for that contribution. Yes, like you said, public sector is government-owned health facilities, like the health centers, the general hospital, the teaching hospital. Those are public sectors. While the private one, like you also said, is individual homes. And the NGOs is also there. So thank you so much for the contribution. Don't forget to attend to your quiz. I'm still expecting more people. I can see more people in class, and very few are responding to the quiz. It carries marks. It's your choice. You choose to do it and hand your mark. You neglect it and lose your mark. But every mark counts. One mark can take you to a distinction, and it can also make you fail. So don't neglect opportunity to hand a mark. All right, that's it. So furthermore, we are going to look at monitoring. We'll just look at resources. So what is monitoring and what are we monitoring? That's what I'm going to share now with us. Monitoring, we've looked at the resources. We talk of human resources, we talk of finance, we talk of materials. But before we look at monitoring, when we say finance, we look at it that financial and material resources, like I said, are essential as human resources for the successful implementation of the strategy. That is, whatever strategy you want to carry out in health, in primary health care, finance and material resources, as well as human resources, cannot be overemphasized. And this finance or the cost or material resources involve efficient use of existing resources. Already you will have things in place, that is, you have materials in place. Now you have to look at it. What more do you need to make provision for in terms of, okay, you have this number of shares or number of beds, number of mattress. You have 20 million naira in the account, but what you needed will require like 500 million. So you know that you need additional 300 million for this budget to be, for the project, I mean, or for the program to be rolled out. So all these are finance and materials that is required. And usually, National Health Development Plans in Nigeria makes plan for 10 years. The first National Health Development Plan that was done in Nigeria was between 1946 to 1956, which is a 10-year budget. The next one that was planned or developed was for 5 years, which was between 1970 to 1974. And the third one was done for 6 years. And the one that was done last, which was the fourth National Development Plan since 1988, is the one we are still using up to now, up to date. You can see it's old. It needs to be reviewed. It needs to be reviewed. So that is healthcare resources so far. Now, monitoring. We look at what is monitoring and what are we going to be monitoring. Of course, it is very important that the progress in implementation of any strategy, whatever you are doing, it is very important to monitor it. You want to monitor for you to be able to evaluate the effectiveness and the efficiency of the program. Take, for instance, when there is a rollout, of maybe an immunization against a particular disease, do you think it's essential for us to monitor the progress? If yes, why do you say that? Okay, I see your question, your answers coming in. Thank you for responding. Yes, yes. Thank you for responding to the quiz. It will be marked and graded. So, as I was saying, that for every strategy that is put in place, it is important that we monitor the progress. Not only the progress, you also want to do an evaluation of the effectiveness of it. And the reason why we do this is what? Of course, we don't just monitor for monitoring's sake. We don't just evaluate a program for evaluating sake. So why do you think we do a monitoring for strategies or programs that is put in place, especially in the primary health care program? Why do we evaluate? Okay. Inoma, I see your hand up. You are welcome to respond. I've unmuted you. Speak. Your hand is up.
In any program we are carrying out, be it immunization, be it family plan. Yes, I've started answering.
Yes,
Like
I'm
my
hearing you.
network. Hello, can you
I
hear
can
me?
hear you. I can hear you. The class can hear you. Speak on.
Can you hear me, ma?
Yes, we can hear you loud and clear. Speak
Okay.
on.
I say in any program we are. Okay, ma.
Speak on.
Okay. I said in any program we are handling, be it immunization, family planning, rollback malaria, there is every need to monitor that program and evaluate it. Because when you monitor it, you now know that this program, there are people that benefited. We achieve our gains, our goals and objective of carrying out such a program. And like family planning, for example, at the end of the day, our aim, did we achieve it? Maybe we want to reduce the population. We want to make sure that women are giving birth to at the time they want it, not by mistake. You know, they will come and tell you that this pregnancy I'm carrying is.
Okay. I guess the network is poor on your side. We've lost you. All right, thank you for that contribution. Yes, it is important that we monitor program or projects that is being conducted, especially at the grassroots level, which is the primary health care facility or centers. The reason is we want to look at the effectiveness of it. We want to look at the efficiency of it. Is it achieving the aim in which we are implementing it? And we also want to know what needs to be enhanced and what needs to be eliminated. Initially, you might think that, oh, you need just 5 manpower. But in your process of monitoring, you might discover that, oh, you need more than 5 manpower, or you might even discover that, oh, that you need more materials, So far, that is the importance of monitoring. And we also looked at, so we've seen the importance of monitoring, and we've agreed that monitoring is essential in any program. So we also want to look at surveillance. Is surveillance and monitoring the same thing? It's not the same thing. Monitoring is different from surveillance. When we say surveillance, what does it mean? It simply means that you are watching over with great attention. That is, you are giving every minute details of the progress of that program. That is surveillance. So surveillance and monitoring are slightly different. And so it is there is a continuous scrutiny of the factors that determine the occurrences and distribution of diseases and other conditions of ill health. So you do a surveillance program to assume any character or dimension that we have epidemiological surveillance. That is why we have epidemiological surveillance, as well as demographic surveillance and nutritional surveillance. So in this, there is a scrutiny that you are doing to see, okay, what characterizes this? Why is this happening? And it comes with objective. Surveillance as objective. You have the reason why you are doing the surveillance. You want to achieve something. You are looking for something. And so some of it are to provide information about new and changing trends in the health status of a population. So you want to see what is trending in the health of the community. You also want to be able to provide feedback on the expected modified policy and the system itself. So all these are the reasons why we do surveillance and monitoring. And also, you want to be able to warn people of the public health disasters. If we don't do surveillance, we won't be able to know that, oh, that there is an outbreak of this. And so community members should stay away from this or do that. And so it also helps us to provide a warning to the community when we do a surveillance. So what is evaluation? Evaluation, on the other hand, is the process by which results are compared with the intended objectives. You've done your monitoring, you've done your surveillance, and now you want to evaluate the outcomes. What is the outcome? You want to compare it with your set objective. Remember, at the beginning, you have objectives. You have your goal. You have your aim or the objectives. Now you want to compare it with evaluation. It is a comparison of your results now. And it is always after you have implemented your plans. The plans has been implemented, and now you want to evaluate. Why is evaluation useful? Of course, you agree with me that evaluation is very, very important. And the reason why it's important is it shows us the growing concern about the functioning of a developing country. When you do evaluation, you'll be able to know that, oh, there is this program that has been done. And you want to be able to ask questions or raise questions on the quality of medical care, the utilization and the coverage of health services, as well as the benefits to the community members, and also the reduction or the increase or reduction in the mobility and the mortality rates of the nation. And so we have elements of evaluation process. We are gradually coming to the end of unit 5. And so we have evaluation review is relevant. The relevance or the requisiteness relates to the appropriateness of the service. You want to look at it, is it relevant to what you provided it for? And at the same time, the service, for example, when you are providing a vaccination for, take for instance, a chickenpox, and there is no outbreak of chickenpox or smallpox, you ask yourself, why are you providing that service? And so there is no way you are going to be able to evaluate it because there is no an outbreak of that disease for you to have provided that vaccination. And so you also want to look at the adequacy. What is the adequacy of materials? That is, do you have sufficient materials that are provided for the program? Because if you don't have sufficient attention or programs or budgets, then in your evaluation, you are not going to achieve your aim. You also have accessibility. So in accessibility, you want to make sure that there is no barriers to accessibility of both in terms of community member moving from their homes to where they can access health service. And you also want to look at the acceptability. Is the program you are providing for the community, is it applicable to them? Is it acceptable by them? So all these are very important when you are evaluating, and you also want to look at the efficiency of it. Is it efficient, and is it impacting on the community members? So all these are very essential for you to evaluate when you are looking at evaluation. That is, your planning and evaluation must be viewed as a continuous interactive process. When you're doing evaluation, and you continue to evaluate until you meet. So you see where you need adjustment or modification, or you need modification. Okay. All right, so far that is unit 5 that we've just discussed, which is healthcare resources, monitoring and evaluation of health services. And I want to say thank you for those of us that made it to class today. For those of us that contributed, thank you. And for those of us that did not contribute this week, hopefully you will be encouraged. You have been encouraged to also let your voice out by next week. So this is where we are going to end it today. I'll see you next week. I'll meet with you again next week, Thursday, same time.